Members, good morning. Good morning, Ms. Jamke. Just want to double check with you on my clock. We've got 2 minutes left.
It's 8 o'clock, Chairperson. Morning, Chair, morning members,
Good
and morning,
morning.
colleagues. It's 8 o'clock now. I think we can start, but I don't see the minister here and the HOD.
Minister Mbombo and Dr. Klute both confirmed their attendance. Can you just kindly check those that we are admitting currently, Ms. Jamke? Members, in the meantime, we will start our proceedings since it is 8 o'clock. A warm welcome and to all members present, Minister Mbombo, Dr. Klute, and all departmental members to the Standing Committee on Health on Wednesday, the 9th of June, 2021. And members and guests, allow me also to welcome all guests that will be joining us this morning. Today, the Standing Committee will be deliberating on the annual report of the Department of Health for the 2019-2020 financial year. I just wish to remind members of the cardinal rules of online conferencing. At this point, can I kindly ask members to please switch off all videos, kindly to mute yourself as well. On your right-hand side, you will find the chat function if you wish to draw the attention of the chairperson or the procedural officer. In the absence of a raise hand function, members, you may also make use of that function. I will also allow members to, once they have been recognized, that they, for that purpose, may then switch on the videos as well as their mics. Members, I will now ask all members of the committee to please introduce themselves. You may proceed, members.
Good morning, Chairperson, everyone. My name is Rachel van Vogel.
Good morning, Chairperson, Regan Allen.
Good morning, Chairperson. I'm Gillian Bosman. I'm standing in for Member Lorraine Portal.
Is that all members present? It seems that that is all members. Dr. Mbombo, Minister, are you on? Ms. Jamke, can you kindly check for us?
Chairperson, the Minister has just joined. Thank you.
Thank you, Dr. Klute. Good morning, Minister, and welcome to you as well.
It's doing it again. Sorry, Chair. Okay, it says video is in. We couldn't use your cam. Good morning, Chair. Can you hear me?
Yes, we can hear you. Thank you, Minister.
Okay, because I don't know what...
just now at the introductions.
Okay, thank you very much, MEC, for help in the Western Cape. I'm not sure others have introduced themselves.
Not yet, Minister. We will get to them. Thank you very much. HOD.
Thank you very much, Chairperson. Dr. Keith Klute, I'm the Head of Health in Western Cape. Allow me to introduce the members from the Western Cape Department of Health, the senior management team. The first one is Ms. Bernadette Aris. She is the Chief Director for People Management. Then we have Dr. Bhavna Patel. She is the CEO of Grootsky Hospital. We have Dr. David Pinaar. He's a public health specialist with Rural Health Services. He's standing in for Dr. Renette Kraus, who is the Chief Director for Rural Health Services. We have Ms. Esme Isaacs. She is the Chief Director for Supply Chain. We have Dr. Gio Perez. He's the Chief Director for Metro Health Services. We have Mr. Glenn Carrick. He's the Acting Chief Director for Finance. We have Ms. Juanita Arendse. She's the Chief Director for Specialist and Emergency Services and Clinical Support Services. And then Dr. Chris Valabji, he's our Chief Director Strategy. Dr. Laura Angeletti Tutue, she's the Chief Director for Facilities and Infrastructure Management. And then Dr. Matotsi Mkosi, he's the CEO for Tygerberg Hospital. And then Mr. Peter Smith is from People Management. He's with Mrs. Aris, a specialist in the people management area to look at all the people-related issues. And then Dr. Sadi Karim is the Chief of Operations. Then Mr. Simon Kay is the Chief Financial Officer, but also the Head of Corporate Services in the department. And then Ms. Dr. Wendy Waddington is a specialist working in our medical legal unit. And she's a very experienced manager that used to be a manager of False Bay Hospital, but she's now working in our medical legal unit. That's the full team from the Department of Health. Thank you, Chairperson.
Thank you very much, Dr. Klute. Indeed, a full compliment. Thank you very much to all departmental officials present this morning. Are there any apologies at this point? Member Bosman is standing in for Member Botha. Any other apologies?
All the other committee members, Chair, are present in the meeting.
Thank you very much, Ms. Jamke. Members, we will be excusing Minister Mbombo and Dr. Klute at 10 o'clock. They have other commitments that they need to attend to. So I would kindly ask members to please take note of that, and any questions stemming from our business of the day, kindly pose those questions in that time frame. And can we kindly be disciplined in that? As always, members, I would really appreciate that. I also wish to ask at this stage, do we have any members of the public present this morning? Doesn't seem like it, so we will then proceed. Members, I will now ask Minister Mbombo to, in a 5-minute slot, if possible, Minister, just to give us a brief overview and your remarks on the annual report under review, please, after which the HOD can add on to or perhaps give his part as well. I will now give over to the Minister and to HOD.
Chairperson?
Yes.
Yes, sorry to just patch in like that. I raised my hand. I'm not sure if you managed to see it. Melika Eklego from the EFF. I'm also part of the meeting. I just joined the meeting late.
Wonderful. Wonderful. Thank you so much, Member Tejo. Ms. Jamke, can I just kindly ask you to just also assist me in recognizing those hands? We are just also operating our documentation online, so it is a bit attending to both. Thank you. Over to you, Minister Mbombo.
Thank you, Chair. I won't be long. Thank you for the invite. Also take into consideration that this is the report of on what happened in 2019. So this is a pre-COVID report, and many things have happened since then. So just for the members to be reminded that, so on any questions related to the COVID, we can only respond up to March 2020, which is the first cases in South Africa, but it was not part of this. Also that this is part of the strategic plan for the 2030 Western Cape, which is, we drew it in 5-year chunks. So this forms part of the first chunk that's supposed to end in 2024. And also that members to recall that if this is also the year of the elections, which is some of us were not even sure that we're going to come back. And you might see that there was a lot of the infrastructure that was planned at the time, and also we opened at the time, because we wanted to make sure that we fast-track some of the hurdles related to the infrastructure. This is the year actually where we had, we used all our budget for the infrastructure. And also this is the year where we had a clean audit, second time. It was also the year where the HOD, former HOD who retired, Dr. Beth Engelbrecht, at the time, it was also her final report. So, and also you might see in my foreword that I also spoke about the universal health coverage, because it was the year when we were up and about in regard to the NHI bill. And for us, where we did make ourselves available to the national to ensure that we have a pilot for the universal health coverage. As we know, that's a language we speak for, because NHI, according to their definition, is for UHC, but for us, it's about NHI is just part of the parts going toward the UHC. So you might see where we said that we already collaborated at the time inter-provincially with the Eastern Cape, and the KZN was on board, which is we held meetings as officials and also as MECs, which is, I think the last one to host was me in my office at the time. So all those things now post-elections changed completely, because we ended up having different officials, specifically the political heads in those departments. So having said that, Chair, as I indicated earlier, one of the highlights for that is because it was our second clean audit. And also one of the highlights is about, you will find that it was the year of the infrastructure. And also, as I indicated, that it was the year that during the term at our office, and also it was coincidental, also the term for the HOD. But having said that, everyone else has been part of this process in the Department of Health, the current HOD, the whole team that is there, because for us, I always say that we are actors. And then there are many of the directors, many of the producers, there are many of the stylists, the people who does our hair, make us beautiful behind the scenes. So these are the people who are here who will be able to answer most of those questions. Thank you to the staff. Thank you very much, Chair. Again, reminding ourselves, there is no COVID in this report. Thank you.
Thank you so much, Minister. HOD.
Thank you very much, Chairperson, and thank you for the Minister for the introduction. Thank you for the committee. I humbly stand in front of you as the accounting officer, incoming accounting officer, and the year under report was the last year of the outgoing HOD, the previous HOD, Dr. Beth Engelbrecht. And I really need to just commend Dr. Engelbrecht for what she's done in the 5 years in terms of building on predecessors of bringing our organization to where it is. An organization that we're all extremely proud of, an organization we're all proud to be associated with. In terms of the context of this annual report, people would notice, and the members obviously know, that this is very late in a financial year to have an annual report. And that was the unusual circumstances we found ourselves in towards the end of this reporting period, which is the last 2 weeks of March. And then from the 1st of April, what COVID did to us, both in terms of our response, but also in terms of being able to compile an annual report and complete an audit. So the Auditor General is very clear on why we have this delayed tabling of the annual report, but I'm very proud with the delayed tabling that we can reflect on a year completed prior to COVID. And the great successes that we've achieved during that year. And really just to commend everybody in this team and everybody that's worked extremely hard in 1920 to prepare us for what actually happened in 2021. And for us to be able to say that we have a clean audit for a second year in a row. It is a very great achievement for an organization with the complexity of what we preside over. So I'm just humbly standing in front of everyone, in front of this committee, and we're humbly tabling the annual report in terms of the performance for the 1920 financial year. Thank you. Thank you, Chair.
Thank you so much, Dr. Kluter. Members, at this point, I will ask members whether they have any questions based on the overview presented by Minister Mbombo as well as Dr. Kluter. If the members, this is also a public hearing, so should there be members of the public that perhaps joined us in the meantime, the committee must also afford them the opportunity to pose their questions. So now I will immediately ask members by a show of hands if you do have any questions at this point. On my side, I do not see any hands. Nothing, members? Any member of the public? Doesn't seem like it. Thank you very much, members. Then we immediately proceed. Members, as you will know that the report is in various sections, so we will deal with the report accordingly. So, Ms. Jamke, can you kindly indicate, will it be flighted or do we rely that members will follow on their side and then refer to the necessary pages accordingly?
Members are supposed to refer to the necessary pages, Chair.
Thank you very much. And that information has been made available. Members, you will then find Part A of the 2019-2020 annual report, general information on pages 5 to 26. Is there any member of the committee that have any question on that specific page that you would wish to pose to either Minister Mbombo or Dr. Kluter? On my side, I do not see any hands. Please do indicate in the chat function if you perhaps are unable to use the raise your hand function. I do not see any hands. Can we then proceed, members? On part B of the report, we will find the performance information based on the department, and that is on pages 29 to page 101. Is there any member that have any question relating to those pages? I recognize Member Windvogel. You may proceed, Member Windvogel.
Thank you, Chair. Just for clarity, Chair, I missed, you are saying from page what? Can you just repeat that one?
Part B of the report, Member Windvogel, the performance information, pages 29 to page 101.
101. And that's part B of the report.
Yes, Member Windvogel. Do you have any questions on that part of the report? Member Windvogel?
Chairperson, if we can go to page 21, sorry, to page 27. No. Chair, can you hear me? 32, page 32, part B.
I can hear you, member. You are most welcome. Please proceed.
Perhaps what update can the department give us regards to the rebuilding of the US hospital? And then, Chairperson, if you can go to page 35. Is there any consideration given to safety of patients who wait outside the gates in the dark and in the cold? If not, how can this be factored in? And then on page, I think you said 41, It's my last question, Chair. We have to, at least we have to congratulate the department for the clean audit and encourage officials to put measures in place to improve conditions in our health facility. As it is kind of pointless to have a clean audit when patients sleep on the floor and recording over 500 cases of irregular expenditure. Thank you, Chairperson.
Thank you very much, Member Van Vogel. Member, can I perhaps just ask on your question on page 41, are there any specific case that you refer to? Can you hear me, Member Van Vogel?
It's what I experience and the reports that I receive from people out there. My brother was one of that, and that's why you will see I always point on the issue of temporary workers, of contract workers, because there was no, so that's why I'm saying it's part of a life experience, people who sent us complaints and problems.
Okay, you are making a reference to one incident. Just perhaps for the department or the minister or the HOD, that's why I'm asking. Then perhaps they can respond to that incident if they know about it. So I was just asking for clarity. That is your 3 questions. Thank you, Member Van Vogel. Member Allen.
Thank you, Chairperson. Maybe not a question from me at this stage, but more to just make a comment and to appreciate the work that has been done during this particular financial year. And as we have heard regarding the clean audit, as well as page 18 making reference that no unauthorized expenditure has been recorded, no fruitless and wasteful expenditure was incurred during this particular financial year. And from where I'm sitting, Chairperson, to the department, this year obviously played a role towards the department heading into the new normal and COVID and how they dealt with that. And I wish to commend the department. Thank you.
Thank you very much, Member Allen. I do not see any further hands. You can kindly lower your hand, Member Van Vogel. I will now afford Minister Mbombo as well as Dr. Klute to respond to Member Van Vogel. Thank you.
If I can start, Chair, probably HOD can add. On regard to the Josta Hospital, I think for the 2020 or 2020-2021 report, when you bring us back, we could be able to inform you further. But generally, it's still part of the process, and also it's still part of where we want things to be. But taking note that with the COVID, especially the lockdown specifically, there have been many of the infrastructures that ended up having to be delayed in order to meet the lockdown requirements. But also in regard to the diversion of the funding and all of those, taking note that there was some monies that we promised from the National Treasury in regard to the Josta and Tygerberg Regional Hospital, which is the 2 ones that we are prioritizing in regard to that. In regard to, Chair, when the question is general, it means I have to respond generally because it's not specific in regard to on that page general. So the general one, it's about the complaints, people sleeping on the floor, that we cannot brag about the clean audits. Of course, clean audits is just one part of what we are supposed to do, and we wouldn't be going to the scopers and all of those if it was not as important. The mere fact that there's an oversight from the members to see to it that we spend the monies, taxpayers' monies, accordingly is because auditing is essential. With the 7 million of the people that we service in the Western Cape, of course, 20% of them, or 15, now might be uninsured, insured population. But it doesn't mean that we also not have to, as a steward, still have to be responsible for such. So just like in a pack of apples, there will always be that one that will find that it might be rotten, or the other one where it might not be of quality. So there is no way that we are bragging that we could be able to satisfy all the 7 million, because we are also humans. In as much as that we are healthcare workers, we are humans. But what matters is that when we err, do we apologize? Do we also have processes in place so that to accommodate those people who might not suppose some of the people don't want to go to court, to lawyers. So, bro, that's why we have got the lowest a bill when it comes to litigations in the Western Cape compared to the others, where actually the whole budget of the year for that province supposed to go to the litigation. But what's crucial is about, do we have the processes where people can have a space to converse and get answers about what happened? Because in most instances, we find that people only wanted to find out what happened. Similar, when people might be posting some of the pictures that people are sleeping on the floor. In some instances, it's about when the person says that this chair is uncomfortable. I would love, and I've been sitting in this chair, so I would love just preferably to lie down. And then people take pictures. So that's why I always say that people must ask, and then we can be able to respond. Having said that, Chair, again, the issue of them now was also about the clean audits. So that's why we also look in terms of the outcomes. During this report, if you look at the quadruple burden of disease and the health outcomes generally, which is other indicators that we as the health system get assessed or evaluated upon, you'll find that we excel in most of those. I'm talking about the child health, the maternal health, some of those communicable diseases, the life expectancy, access to the health services, because even if you don't have a clinic in a particular area, we'll make it a point that there is a mobile that comes there. Even in that particular a physical or fixed clinic, if you don't have the dental services or the eye care services, you'll find that on a monthly basis that the people who have an opportunity, whether to be taken to the nearest one, or we bring whether the radiographer or the oral health therapist and all of those in those clinics. So without bragging, the fact remains that our health outcomes during the time of the reporting were the best compared to the other provinces. However, we are not bragging in regard to that, because we do know that there's an opportunity, there's always a gap where we need to improve. Because at the end, as Member Vonfofal has indicated, if Auntie Sarah doesn't see, because the clean audit, Auntie Sarah who's there in Maritzburg, doesn't know what we're talking about. For her, it could be that there's that particular healthcare worker who always makes a point that she doesn't open the clinic on time, or she's rude and all of those. So that's why we have these hotlines so that people could be able to report to. And that's why we have got all other aspects where people could be able to complain. Lastly, in regard to the people waiting outside, it will always be the case everywhere. It's about where, even if the clinic opens at 8, you want to be the first person, whether you are going to Home Affairs, whether you are going to any, you want to be the first. So you think that because I'll be there at 4 a.m. and then I'll end up being we get done. But we do know that it doesn't work like that. Even in as much as that, we will say that come at 8 o'clock, or like, for example, in Vanguard, where they'll say you are in the 8 to 10 o'clock slot. So come, or you are in the 10 or 12 to 2 o'clock slot. So come at 12. But everyone will want to come early in the morning. And then on the issue of the after dark and all of those, in some areas we'll find that we do have inside the yard, we have the after dark, and also they might have the security. In some areas we work with the municipalities where they could be able to, some of them, to take, especially for those who are waiting for their pickup, points in regard to their appointments in other facilities where they could be accommodated even in the councillor's office, churches and all of those. But in some areas, for example, in Nyanga clinic, there's nothing we can do as a health, because health is everybody's business. But that's why we're saying that with the communities that are there, through our health committees and everyone else, and let's take a responsibility to ensure that people are safe, because these are vulnerable people, because the situation, the environment is not conducive to anyone. As yet, our healthcare workers will make sure that to rock up and come to work, in as much as that in some instances there might be the gang fights and the bullets, whatever, where going astray and all of those. But no matter what, our service are always open, in as much as that is even dangerous for our healthcare workers. So that's why we're saying that health services is our own business, but health is everyone's business. We call for everyone to take some responsibility. And thank you even to the municipalities, who some of them, they even offered like the AFDAC in some other areas, like in Zenetem and Bredeville and all of those. But also even for some of them where they'll say that we will open our our halls and all of those. But anyway, as I indicated, Chair, that we have to, it's a whole of society, it's a whole of the government. Thank you, Member Allen, as well for your questions. I think I've covered everything. I don't think HOD has to cover a part of it, because we are still far and we have to leave at 10. Thank you, Chair.
Yeah. Thank you so much, Minister. Dr. Klute, is there anything that you would like to add?
I think, thank you, Chairperson. The Minister has covered most things, but just to say two things. Firstly, in the period under reporting, the Klipfontein Regional Hospital was formally registered on the national process, and monies have been allocated for the process. As the Minister rightfully says, in subsequent reporting periods, we will give update of exactly where the process is with projected timelines for completion. In terms of the general other comments Minister Windvogel, Member Windvogel has made, I agree with the Minister. I do think it's important that a clean audit is a financial accountability and how we stringent with our processes. Accountability in terms of serving the citizens' needs and being compassionate to citizens in need is something that we take very seriously in our department. Therefore, any incident of somebody having to lie on the floor because the hospital is full, we take seriously. That's because of service pressures, and we work with all of those. And then as it is to the dignity of people attending to our facilities, we have a program to actually bring the shade online for people, but we have to have a process of looking at appointments and all of those. So we take those comments seriously. It is something, the dignity of the people that come to our service is a big priority for us. Thank you.
Thank you very much, Dr. Klute. On this part, are there any follow-up questions, members? I do not see any hands. Member Windvogel.
Thank you so much, Chair, and thank you to the Minister and Dr. Klute for that response. And I think we're on the same level if it comes to service delivery and the dignity of our people. And on that note, Chair, I just wish to understand how did it occur that the department occurred over 500 cases of irregular expenditure, as reflected somewhere in, I'm not sure, page 200 and something. But what I want to know is what mechanisms are in place to improve the SCM. Thank you, Chairperson.
Minister Mbombo or Dr. Klute, you're welcome to respond.
I think Dr. Klute can respond, but also noting that the denominator, it's a 500 of what? And also in the taking into consideration that overall we had clean finance, we had the clean HR, we have clean of everything. Noting how the AG works, it talks about the threshold. So the mere fact that we have got that 500, it doesn't mean that it didn't reach that threshold in regard that we could be able to have a finding. But the AO accounting officer can elaborate on that. Whilst the question is important, but again, the relativism in regard to relative to what? because it might be 500 of 2 million. So in as much as that it is an irregular expenditure, but the mere fact that we have got a clean audit, it means that it didn't reach that threshold that it could be found as a finding as according to the AG. Thank you, Dr. Klute.
Thank you, Minister. Dr. Klute.
Thank you, Chairperson. I'm largely covered by the Minister. It is really to just understand when we do get to that section, that how is a regular expenditure recorded? What do we do with the regular expenditure? How we process it and manage it, and not in one financial year, but also over financial years. But the Auditor General does look at is what's the materiality and what's the risk to the department. And as the Minister said, we have a very stringent process to work through irregular expenditure over years, and to work with it, to understand it, to put systems in place to make sure that we improve our process in our department. Thank you very much.
Thank you very much, Dr. Klute. Members, we now move over to part C of the report. Members, this is the governance part of the report on page 103 to 116, and this section will be dealt with by Scopa, but members are allowed to ask questions on this. If you have any questions, please indicate so now, as well as the page number, members. Thank you. I do not see any hands on my side. I recognize Member Baku Vos. You may proceed, Member.
Thank you, Chair. Can you hear me?
I can hear you. Thank you.
Good morning to everyone. I would like to ask a question on page 106.
You may proceed, Member.
The question is as follows: to what extent is sexual harassment in the workplace a significant risk in the department, and what is done to prevent it from happening? That's my first question. And the following question, the first question, the following question is also in 106. And
you please proceed, Member. We seem to have lost.
Can we be finished with a detailed report of the state of all facilities in the province and updates on renovations and refurbishment?
Member Baku Vos, Member Baku Vos, I'm so sorry to interrupt you, but we lost the first part of your second question. Do you mind just repeating your second question, please?
Problem, Chair. Can we be finished with a detailed report of the state of all facilities in the province and updates on renovations and refurbishments that have taken place between 2019 and 2020, also between 2021 and 22? Thank you. And which hospitals are in a worrying state, and what are the plans to renovate them? My last question, Chairperson, is on 107 in the first table.
You may proceed, Member.
Yes, follows for the cases that were open in 31 March 2020, what progress has been made in investigating them? And what was the nature of transgression? And the second one is for the cases that were closed in the 2019-2020. Can the department please provide more details on matter investigated and the recommendations that were given? Sawubona, Minister, ndiyakukhumbula. Thank you, Chair.
Thank you very much, Member Baku Vos. Member Baku Vos, I am ruling on question 2, that as a committee, we put that as a resolution to the department and request the relevant information as you have indicated with regards to
Sorry, Chair,
renovation.
can I pose the last one, the last one now?
Member, I'm just concluding on the ruling pertaining to question 2, that we will put that as a resolution of the committee to the department, requesting that report pertaining to renovations made to facilities. Is that in order with you?
Yes, lead.
Thank you. Member Baku Bakufos, do you have another question? So you have now
Yes, it's
2
also in
questions in the bag.
107.
Also on 107.
Thank you, Chair. I want to ask the department, how did the department minimize conflict of interest during the COVID-19 related expenditure, and were there any cases of irregularities identified? Thank you, Chair. That was my last question.
Which page were you referring to, member?
It's 107.
107. Thank you very much, Member Van Vogel.
Thank you, Chairperson. Chairperson, my question is on, I will start with 108. I just want to find out from the department, are all our facilities fire compliant? And if not, which ones are not? And then if we can move to page 110, 110. How does this figure compare to the previous financial year? Has it increased or decreased? And from which program was the irregular expenditure occurred? And what are the details of products that were procured? Then, Chairperson, on page 111, how is the department intending to minimize its reliance on seasonal workers? And this one is very personal because I lost my brother because of that. There was not enough staff to assist him. And what is stopping the department from employing permanent staff with money use on seasonal workers? Then, Chairperson, on page 116, deploying and implementing a preferable procurement policy. Can we get a progress report in this? Perhaps we can make it one of our resolutions. And when will it be fully implemented? And what is causing all the delays, and for how long has it been in progress? Thank you so much, Chairperson.
Thank you very much, Member Van Vogel. Can we then agree on your latter question? We put it as a resolution of the committee. I recognize Member Barnes. Did I not just see Member Barnes' hand? Is she on? She should be. Member Van Vogel?
I'm covered, Chair.
Thank you very much. Will you kindly lower your hand, Member Baku Bakufos? If there's no other questions from members, I will now ask Dr. Noma French Mbombo or Dr. Klute to accordingly respond or refer to the departmental officials concerned. You may proceed. Thank you.
Dr. Klute will respond on specifics or directly to anyone from the director or other directors to respond. I'm just responding on the under general. For sexual harassment, it's each and every institution or organization or every sector, it manifests. It's a manifestation. It's a microcosm of what is happening in the larger society. So people who are point, they're coming from the same communities. From the same society. So if we've got a dysfunctional society where we've got perverts or we've got abusers and whatever, it means that in any institution, you are bound to have the similar kind of the pool of people. So my point is, it's not about that in health. We have got people who are many who are sexual harassers and all of those. But what is crucial is about the processes that we put in place in regards to the labor relations, acts, application, the Basic Conditions of Employment Act, and also the disciplinary matters as according to from our HR. So Dr. Kluti can respond specifically, but I was just highlighting in regard to that aspect. In regard to the maintenance of the infrastructure, always at the back of the pages, you'll see all the infrastructures per district, and also in regard to things in the APP, in regard to their stages of where they are. They will talk in terms of the delivery model, management, where they are. So it will talk about whether it's in the concept phase, whether it's only the replacement, or whether it's about the new, or also about extension and all of those. So if you look in terms of the back pages, each and every year of our plans, you'll see that part of it. So what I would suggest the members, they just need to, in the whole pack of those, they must identify which ones that they are interested in, because everything is there at the back in regard to the infrastructure, whether it's maintenance or whether it's whatever. And then I wasn't sure, member Von Vogel was asking about sessional or seasonal workers. I wasn't sure exactly.
I heard seasonal workers. Can you just clarify, Member Van Vogel?
Yes, Chair. Contract workers, or you call them seasonal.
Oh, okay. Okay. So I think the whole pack of the HR, over to Dr. Kluti just to respond in regard to that part of it. Thank you.
Thank you, Minister. Dr. Kluti.
Thank you very much for that. Minister has covered the sexual harassment. So the detail is we have a very, very clear sexual harassment program in the department. It is geared towards detection, reporting of sexual harassment, and not harassing anybody that is a victim of sexual harassment. We have immediate disciplinary processes of suspension, precautionary suspension for investigation. And if any valid reasons is found in disciplinary reason, we have a very strict policy of dismissal. So it's a zero tolerance for sexual harassment. And we also have a program in our employee wellness program in our system, which actually raises awareness around sexual harassment and really the rights of people to be able to speak up and to come forward if they feel inappropriate behavior is directed at them. Then I think I'm covered, Chairperson, by your resolution of giving us the detail. We will give you the detail as requested. Then I'm going to ask Mr. K to respond on page 107 to the number of cases that's been opened, the nature of the cases, and then also in the issue of the conflict of interest, although not in this reporting period. Just to state, COVID procurement was not in this reporting period, but only to say that during 2021, which is subject to the audit engagements since the 1st of April, there were 2 special audit reports by the AG, and nothing in the Western Cape has been found to be wanting in terms of conflict of interest. So we have a very clear process that is outside this reporting period, but since April, in terms of the processes we've put in place. So I'm just going to ask Mr. K just to reflect on the nature of the cases on page 107. Then I'm going to go on to the fire compliance on page 108. Again, there's specific detail. Dr. Angeleti de Tooy can just give you a very clear, direct answer to the fire compliance story. And then on page 110, Mr. K will also give this issue about the amount that in 1920, our department will report 6.4 million irregular expenditure. You will give a context for that figure in terms of what it was the year before, and also what it is in terms of what that represents specifically. And then on 111, I understand Member Van Vogel's question. Just to make a clarity, when we talk about contract workers, which is in other parts of this report, contract workers are, if we have somebody that is a registrar or an intern, that's medical doctors, that studies to become specialists, they are in contract positions because they're not permanent employees, they study all interns for year 1 and year 2, and all registrars are contract. So you need to understand, when we talk contract workers, there's a big proportion of our workforce that by nature of what they do, they are contract appointments. In addition to that, we use agency staff. That's a different part of work where we bring agency staff in for service pressures or for people going on leave. The strategy of our department over the years has been to reduce agency staff use so that we can use and convert that money into more permanent staff and more staff that we can bring into the system. That is separate from, again, outside this reporting period, which is for the next reporting period, when we have situations like COVID and the others, when we bring short-term resources in for short-term contract appointments. So it's 3 clear, distinct processes, Chairperson. And it's important for Member Windvogel to understand that there's 3 different contexts that apply to all of those. But I'm just going to ask Mr. K and then Dr. Angelita to give the details. Thank you, Chairperson.
Thank you, Dr. Klute. Mr. K, you may proceed.
Thank you very much, and good morning, Honourable Chair, Honourable Minister, Honourable Members. So the FPS or the fraud cases are reported through Provincial Forensic Services, who then do investigations and report back to us as a department on actions that have been taken or that need to be taken. We are able to provide the details, so should the committee so wish, as to exactly what cases were active at that particular point and what have been closed, because it's an ongoing rolling register. So what is active today may not have been active 18 months ago, and we were able to provide that information. I was asked to talk a little bit about irregular expenditure. So if I may refer members to page 239. It's in the financial statements. And that gives a very detailed breakdown under note 23, which includes the reconciliation of irregular expenditure, and note 23.2, which gives details. So the question that was posed is, how does irregular expenditure compare 2019-20 to 2018-19? Well, there's been a reduction in irregular expenditure identified during the year from 13.26 million down to 6.472 million. And I think the Minister has covered us in terms of the number of transactions relative. And you can see in 23.2 is the disclosure of the type of transactions that happen. There was another question around conflict of interest, which I think had been responded, but again, there are a number of auditing techniques and tools that are available. So, for example, when one procures off the CSD, the list of all the directors are included in the procurement details of the company. And then we're able to match the personnel numbers and the ID numbers of all state employees against directors. And that's done for the whole country. And is where issues can be picked up. Where we do identify people with conflicts of interest, there is a process that is followed. In fact, it's guided by some circulars about a process that needs to be followed and the disciplinary action that ultimately needs to take place. Recoveries are assessed in terms of the irregular expenditure and fruitless and wasteful expenditure frameworks, should there be a necessity to look at that. On the preferential procurement policy, there are guidelines and guidances that have been put out by the Provincial Treasury, which we are complying with, and that is why it was in progress at that particular point in time, and we can comfortably provide an update on that as to where we are at the moment. There have been some issues around some technical problems which are impacting the whole country. around some definitions and who is supposed to actually issue certain certificates. But that's a technical problem that technocratically it needs to be resolved in fact, at a national level. It's not a provincial issue. Chairperson, I think I am covered on the issues that I was asked to respond on. Thank you very much, Chair.
Thank you very much, Mr. K. Dr. Angeletti de Tooy.
Good morning, Honourable Chairperson and honourable members. Okay, on the facility fire compliance, every year each facility is required to have an inspection from the relevant municipal fire officer to go through the facility and issue the certificate of compliance. So the certificate of compliance is actually an annual certificate that needs to be issued. When there are some issue that needs to be raised, the fire officer is given some notice, and then the issue must be fixed and then come back for the final inspection. Now, the facility that at the moment we are dealing with in relation to fire compliance are for the Worcester Hospital. So the Worcester Hospital over the years had quite a big renovation and in different phases. And now we have a contract for the fire the checking the fire compliance and fix whatever is required to get in the certificate, as well as Tageber Hospital. Tageber Hospital also we have a project, actually a few projects in part of the remedial work, and that has been set aside, the budget from Treasury for the project for the fire compliance at Tageberg. Then in relation to a new facility, of course, every new facility when it's completed or major renovation is done, there is one of the requirements is to get the fire certificate from the relevant fire officer. So we get that for all the facility, as well as every time there is an upgrading specifically to the electrical installation. There is also a mechanical installation. There is a requirement for fire compliance. So to give you the number of our hospital, we got 52 hospital, the 50 hospital are fire compliant, except these two that I mentioned, Worcester and Tageberg. And then for the new clinics and community health center and community day center in the metro are fire compliant, and the rest are inspected every year by the relevant municipal fire officer. Thank you very much.
Thank you very much, Dr. Angeletti de Tooy. Members, I don't see any further hands on this part of the report. We will now move to part D, which deals with Member Windvogel.
Sorry for interrupting you. I do just to have a follow-up of a certain part of my question was not answered.
Proceed, member.
On page 116, Chair, on the preferential procurement policy. Remember the first part of my question? I asked that the first part of my question was to type of a resolution, but the second part of my question, what I want to know, what is causing all the delays and for how long has it been in progress? So I think the department can at least answer that part. Thank you, Chair.
Member, can I ask that we put the resolution in entirety to the department? Once they have listed those in terms of procurement, and then we can add on providing the reasons that you are requesting. Is that what you are asking? Can we perhaps put that as one?
No, not the second part I want. Sorry, Chair. No, I asked for my first question to be a resolution, but the second part, I believe the department will have an answer on that one. Don't need to go and look into books. I know the AHOD is very, very good in that, so he will know exactly what is happening in his department. Thank you, Chair.
Thank you, Member Van Vogel. We will afford the department an opportunity, and if it's not the case that they have all the details, we will do a resolution. I see your hand as well, Member Baku Vos.
Thank you, Chair. No, I want to comment in the MEC, the member of Executive Committee, Noma French Bombo. When she responded on the sexual harassment, I think it was unfair because I never pointed that when the department is hiring people, they specifically are making sure that they are hiring the abusers or whatsoever. And we know all those people, yes, in the community we have abusers. But my question is, what are what is their plan to check or to vet the person that they are hiring? How are they doing to make sure that that person is not an abuser? He will not come in their department and abuse or harass sexually our females or even the males then. Because the GBV is not about women and children. GBV is general. Even the male can be sexual harassed. Thank you, Chair.
Thank you very much, Member Baku Vos. I will now afford Member Mbombo and Dr. Klute to respond.
I think that the HOD responded to that in terms of what are the policy imperatives that we have in regard to that, in tackling that aspect. For me, I was responding generally that you must understand that there will always, even when I made an example of a bag of apples, it's about we don't see ourselves that we will have the all perfect apples in the bag. There will always be that one. So that's what I was trying to highlight, is that South Africa is a sick society generally, where we know that it has got the highest number of GBV, which is sexual harassment is part of. That's what I was trying to highlight. Therefore, in any institution in South Africa, you will get those bad apples, which will be beyond that any institution to be able to sift and filter those. So if a person hasn't been generally, again, responding, if the person hasn't been found and there's been any court of law or has been any kind of a reporting, or that even with the referencing, when you appoint the person, the references, and also in regard for the senior management, where they also have to undertake psychometric examinations, and also for others in regard to the interviews, you could still actually have those kind of people, but noting people might not start before. It might be out of the blue. Mbombo has been working for 17 years in the same institution, and then out of the blue changes the behavior. So it is difficult to be able to know exactly whether you'll be a thief or will be a pervert or not. But what matters is about, do we have systems in place to ensure that we take out that immediately and make sure that we implement, as Dr. Klute has already presented. No member workforce, I was responding generally as a conversation about, we are a sick society in South Africa. We will have those kind of people in anywhere. In the churches, we have the people that you trust much as your dominier, who will end up being perverts or whatever, in any way, actually. That's what I was trying to say. Dr. Klute has responded to that, Chair. Thank you.
Thank you very much, Minister. Dr. Klute.
Thank you, Chairperson. Minister Mbombo, as said, I did previously, but just to reiterate for Member Baku Vos, we have mechanisms to detect. So when somebody is employed, one of the things we do is we do a what we call a security check on the person. So if there's been any, if anybody's been found guilty of any offense anywhere else, that check is done before we offer the person employment. Now that is normally for people that has been had a disciplinary process against them somewhere else, we will check that before the person is employed. If they've had a criminal record against them, it will be picked up, and we will therefore influence and screen on the basis of people entering our system to come in. There's been many cases of people for sexual harassment and for sexual crimes that has been tried and have a case against them, and they've also been found guilty in their professional bodies, which we then, through that mechanism, pick up. If that is not against the person, we have a very strict process in the department of reporting, opening, reporting, investigating, and acting very firmly and very swiftly and very quickly for any inappropriate behavior. And we have an awareness program for people to follow, to be able to follow the process. So that is our policy process in our department. When it comes to the preferential procurement, Mr. K did start answering it, but I'm going to ask him just to provide the detail that Member Van Vogel is looking for. Thank you, Chairperson.
Thank you very much, Dr. Kloete. Mr. K, you may proceed.
Thank you, Chair. It gets a little bit technical, so I'm going to ask the Chief Director of Supply Chain Management just to explain the contextual situation we find in. So if I can hand over to Esme. Thank you, Chair.
Thank you very much.
Good morning, honourable members, colleagues. I just want to provide some feedback and input with regards to how policies and legislation, how those are being developed in the department. So the department don't work all on its own. The department makes sure that we are in line with whatever legislation is out there. Wherever we see any risks in any of the legislation that's out there, we try and make sure that we are proactive in making sure that we address those deviations or challenges that's happening in a certain legislative space. So with the preferential procurement regulations of 2017, there was quite a lot of contentious issues in those legislation. And with the regulations issued, there were some challenges in its application. So we as a department had to first wait and make sure that we are doing what's best for not only the department but also for the citizens. So what we decided is we are going to rely on the Code of Good Practice. Now, the Code of Good Practice says that we don't have to develop a policy, preferential procurement policy, but we have to apply the relevant Code of Good Practice. That means our BBBE compliance should be implemented as far as possible. So that being inherently part of our supply chain management policy, which is the accounting officer system, make sure that whenever we do any transaction, it is part of our evaluation criteria. That means each and every transaction gets the relevant points for preferential procurement compliance. So from our point of view also, in October 2019, and this is the year under review, 2019-20, our provincial treasury, who is then our overall policy and guidance body in the province, then issued the consolidation of all relevant SCM legislation via the PTIs. So the provincial treasury instructions were issued in October 2019. This then afforded us the opportunity now with one consolidated guideline document to then continue into the development of a policy. But members must please understand a policy does not mean that it gets implemented. So for us, compliance and implementation of preferential procurement policy regulations is the most important issue of the day. Thank you so much.
Thank you very much, Ms. Isaacs. Member Van Vogel, are you covered?
Yes, thank you, Chair.
Thank you, Member Van Vogel. Members, we now swiftly need to move to part D on pages 117 to 113. Are there any questions from members on that pages? Member Van Vogel, I recognize you.
Yes, Chair, it's just a clarity. I'm not sure. It's like yes, a sound problem on my side. You say it's part D or part E? What did you say?
Part D.
Okay, it's part D.
117 to 133.
Yeah.
Human resource management. Are you covered, member?
Yes, Chair.
So there's nothing from your side on that part.
No, I do have, Chair. I thought, yeah, Chair. Mine on part D, it's on page 130. If the department can perhaps tell us how much the department pay for seasonal workers, nurses, and how much does it pay to hire a nurse permanently, the difference between that. Perhaps it can also be one of my resolutions for the committee. And will the department save if it employs staff permanently rather than depending on seasonal workers? So perhaps I can also make it part of that resolution, Chair. Then on page 130, Chairperson, how much has the department surrendered to the revenue on each year between the year, but now the year under review? Whether the department has considered engaging the provincial treasury for additional funding, even if it's taken from millions that were surrendered. Then my last question, Chairperson, it's on page 138. What are the reasons for heightened overrate and what has been done to address it? And whether the department is in a position to identify employees in it, has invested through bursaries and training that have left the department in the past few years. Thank you, Chairperson.
Thank you, Member Van Vogel. I do not see Member Bosman.
Thank you, Chairperson, and good morning again, colleagues. Chair, I just have a question of clarity. I'm not sure if I heard Member Van Vogel's second question correctly. Was the member asking whether the Department of Health is considering asking the Provincial Treasury to give back money that was surrendered in the 2019-2020 financial year?
I understood it like that. Was what you were intending with that question, member? Member Van Vogel, you are muted.
Sorry, I thought I'm busy unmuting myself. Chairperson, perhaps I must ask the question again. What I want to know from the department, how much has the department surrendered to the revenue each year between, let's say, 2080 and the year under review? And then the other part was whether the department has considered engaging the provincial treasury for additional funding. I'm not sure if I'm clear now, Chair.
Clear, thank you, member. Minister Mbombo, Dr. Klute.
Chairperson.
Member Bosman.
I'm still confused by that question, Chair, because we've had a new budget for the current financial year. So the Department of Health has been appropriated additional money. So I'm not sure what that question is.
Are you the department, Member Gillian?
Members,
You're answering on the department's behalf.
Order, members.
Chairperson, please protect me from Member Van Vogel.
Order,
you are
members.
not the department. You are out of order.
Thank you very much, members.
I really need protection now, Chairperson. I'm very scared.
Thank you very much, members. Member Bosman has been asking a question for clarity, of which Member Windvogel has provided what she meant with the question. I will now afford the department, Dr. Klute, to respond accordingly. Thank you, members.
Okay, I think again, just a chair for general, and then the department can provide the specifics.
You're welcome. Thank you, Minister.
Yes, around the HR, the issue of the contracts, sessionals, whatever, all of those. Generally, the health system, not only for the Western Cape, when it comes to the HR, I'm not sure whether the members they've seen our HR plan, so that you can understand that it's not only about the quantity, like in terms of the numbers, but also it's about the skills mix. As you made aware that we have got different categories of health professionals, like the doctors, the nurses, I think about 10 of the different professionals, physio, pharmacies, orthotists, and all of those, where you have to mix. Just to zoom to the most ones who are in high numbers, which is the nurses and the doctors. There, like the nurses, because I am a nurse, you need to have also skills mix in regard to the specialties. Generally, the default position, people who are specialists, they will, most of them, especially when they are older, they won't want to be bogged down into permanent jobs. Some of them, they might want to do moonlighting in Joburg, or maybe even within the Western Cape, where they might come to public, or other times that they will go to private, especially with the critical care space and all of those. So it's by their choice. They don't want to be permanent because we can make us more money. Similar with the medical specialists. Some of them, they want to be on calls. They are on calls anyway, most of the time. And then others, luckily those ones who may still want to be part of the academic spaces. But generally, some of them, they've got private practice. No one wants to be tied down in regard to that space. And therefore, the majority of the people among the health professionals who ended up wanting to stay is those, of course, who are in the academic space, and also the generalists. So the ones who keep on saying, we want employment, these are the ones who might have completed their ComServe, and then they are generalists, and then they want to, like in the roughly in the Western Cape, from the nursing, in terms of the people who complete nursing in the Western Cape, get about, let's say, 300 or 240 something. So there's no way that the department could be able to employ all those 240 or 300 at a goal in 1 year after each and every year that they complete. So these are the ones who will be always saying that we want employment after they've done their ComServe, because after they've done their ComServe, they are being released to go anywhere and they have to apply for any job. So you need to understand that part of the seasons. And also in the medical, we are also those ones who are NHI appointed, which is they're appointed through the grant, especially for the outreach services in the rural, and also for the ComServe, specifically for the doctors who will be, in terms of the policy, they'll be mostly working also in the district hospitals in regard to that. So my point that I'm trying to make is that it's not that everyone wants to be permanent. And the issue about how much do we pay, it's payment like anywhere, because it's a standardized, it's part of the bargaining, it's also, some of them is part of the OSD. It's a money that is already at a national level that has been agreed upon. So you always know what is the starting salary terms salary scale of a nurse or a doctor or of a registrar or of a specialist in nursing or specialist in the medical, or for a pharmacist. So it's not about us trying to choose which is what. Same applies if you are working the ICU for so many hours, you know how much you get paid per hour in the public spaces, which is might be different in the private, where Mediclinic may say we want to give you extra whatever, or in the net care it could be whatever. So I wanted just to highlight the aspect on the HR. And as again, I will urge the members just to look at our human resource plan so that they could be able to understand what is this skills mix, and also what are the specialty areas, and also must look also at the nursing strategy plan. What are the specialty areas And also, what is this part of the task shifting and all of those that we are trying to fulfill? Thank you. And then the rest, the Dr. Kluti Pate. Lastly, Chair, the issue of the turnover again, because the member asked, what is the reason for the high turnover? Actually, Western Cape doesn't have much of our turnover for staff is not as high. And if you look in terms on page 138, it's about those categories in terms of the salary bands, the one that is related to the upper one, the first table. We find that the highest rate that is there is about 25% for level 15 band. And if you look in terms of the critical occupation for this period, the highest one, which is the medical physicist, it's not surprising to get the rate of a 33%, because the medical physicists, some of them, once they are done with their training and all of those, they want to have a private practice. And some of them, others may want to go overseas or in other, like in Gauteng and all of those. So thank you. Over to you, Dr. Casey.
Thank you very much, Minister. Dr. Kluter.
Thank you very much, Chairperson. So just on the agency question, just to give more detail from Member Windvogel. So if you go to page 128, and a thing that says nursing, and in the first paragraph that says nursing information system, I would refer Member Windvogel to the last 2 or 3 sentences of that paragraph. Basically, as I've said earlier, there are 3 different ways of what we call. So contract work, I've explained, is people that come in for a limited time while they're training and their contract expire. That's your interns, your registrars, and all of those. Then it is agency staff. Now, agency staff is people that we employ on an ad hoc basis as somebody is not pitching for work, they're ill, and there's a critical shortage of staff. We have an agency on standby to deploy somebody to come and work in our system. The question that Member Windvogel is asking, how much does it cost us to pay for that agency member per hour versus how much will it cost us if we employ the staff ourselves? Now, there's 2 parts to that. The part is that the agency need fills a small gap that today 2 people might be on leave or can't report for duty, but tomorrow they're on duty. So it's not a need that you put a staff member and that they work there permanently. So what you need is you need flexibility, where there's a critical need, you get somebody quickly. So that last 2 paragraphs is our own internal departmental process, which we piloted in Klipfontein Mitchells Plain. And it is us creating an internal agency, which means we use that agency personnel, expenditure. We employ additional staff members. We put them in a pool and then we deploy them as they need it. That is what we piloted. So the question she's asking, comparing how much it costs us to pay for agency as opposed to us employing ourselves, that is the purpose of that pilot. That you can see happened in about October, November 2019. The intention is the department will move based on that experience to a system where we will employ more people and be less dependent on agencies. I think that is the question she's asking, and that is the detail in relation to that question. In relation to revenue, in this year, again, as reported elsewhere in the report, we have over-collected against revenue, against the target set. What happens in our arrangement with Treasury is that our over-collection of revenue, provided we don't overexpend our budget, we have an ongoing relationship with Treasury that in our allocated budgets for future years, we get credit of the revenue that we have generated, and that gets added to our allocation as a health department. So in relation to the question, whether we're engaging Treasury, we have over-collected revenue. We've done that for quite a few years. Our engagement with Treasury, when they allocate additional new budgets, they take that into consideration. And provided we have not overexpended, we've been able to actually, in a sense, get the revenue back into our allocation for future years. In relation to engaging Treasury generally about our budget needs, we do that every year in a process called the MTEC. It's a medium-term expenditure committee where Treasury meets with every department. We have the MTEC 1, the MTEC 2, MTEC 3, and we put our budget needs very clearly to them. That results in us coming to this committee to then table a budget as the outcome of that process for every financial year. In relation to reasons for turnover rate, Minister Mbombo started touching on that. But just to remind people, on page 138, that turnover rate, if you take the total at the top there, it's overall 11.2% turnover. That means that it's only about 1 in 10 people that go out of our system. That is an extremely low turnover rate as an overall rate. But if you break it into the various other ones, again, it comes to highly skilled and highly skilled supervision, the high numbers. Again, I explained a lot of that is because contract come to an end. So if you go to the top of page 139 and you look at the 3,426 people that have left, that's now the 11%. You can see that 42% of that is a contract expiry. And again, most of them are interns and registrars because their contract come to an end. They finish their studying. They are now ready to become professionals. And that's why that's the turnover. So almost 40% is that. And if you then look at the resignation, which is only 30% of that 11%, that resignation of 1263, we then analyze the reasons for resignation. And if you go to the reasons for resignation, 20% is better remuneration, so people got a better job somewhere else. 12% is other occupation, and 42% is resigning from a current position. Now, we take this very seriously. We do exit interviews. We understand whether somebody is leaving for better opportunities or are they leaving because they're unhappy. And we take those analysis of the exit interviews and then look at our work environment and try and make our work environment more conducive to retain people. So to say to Member Windvogel very clearly, we have a retention strategy. It is very much built into our culture that we want to create, that people want to be associated with our department, that we're attracting more people and fewer people want to leave because it's a good place to be associated and work with. As I've said, the senior management team believes that we don't want to work elsewhere. It is because of the culture of the organization that we want to be retained in the organization. Thank you very much, Chairperson.
Thank you very much, Dr. Klute. Members, are there any other questions stemming from this part of the report?
Yes, Chairperson.
Yes, Chair.
Can I please ask you to keep it brief, members? I recognize Honorable Bosman, Windvogel, and Honorable Barnes in that order. Thank you.
Thank you, Chairperson. Chair, I would just like to ask if the department can perhaps expand on the Barrett Values Survey on page 124, as well as to indicate whether the department is planning to conduct another staff satisfaction survey once we've hopefully made it out of the troubling COVID period to assess the impact that COVID has had on the employees and specifically their health and well-being. I am encouraged by the results that we see from the last staff survey that was conducted. And I'm grateful that many people in the Department of Health feel that it is a place that they want to work and that they are clear in terms of what they are wanting to do. But I just wanted to check whether there's a plan to redo it, to take into consideration the new normal, as well as the impact of the new normal on those people in our healthcare system, as well as whether the department could let us know a little bit more about the outcomes of the Barrett survey. Thank you, Chairperson.
Thank you very much, Member Bosman. Member Windvogel.
Can we allow Member Buns, because her hand was before me and Bosman. So I will allow Member Buns to take my place because it's not going to be fair. Thank you, Chair.
Are you not posing a question, Member?
I want to pose a question, but I noticed her hand was before mine in Member Bosman's hand. So I'm giving my NC take over then, Chair.
Okay, I have recognized the hands as I see it in order on my screen. So can I kindly ask that you proceed, Member Windvogel?
Thank you, Chairperson. Mine is on page 141, employment equity. what I want to know from the department, what are their plans to increase the number of Africans in the senior top management? And does the department have employment equity targets? Then my second question, Chairperson, I want to know on page 100 in 40, sorry, 154. If the department perhaps can provide more details on the fraud cases, how much was stolen, what sentences were given, what punishments was given for the sexual harassment cases. Thank you, Chairperson.
Thank you very much, Member Van Vogel. I'm just also considering that we put that into a resolution. Is that in order with you? Request the relevant information from the department.
On my last question, Chair.
On your last question, yes, page 154. Is that in order?
Yes, Chair.
Thank you very much, Member Van Vogel. Member Barnes, I was so happy to see that you are online. I thought I was seeing people.
What a nice way to welcome me, Chair. Thank you, Chair. And thank you to Member Van Vogel. Indeed, my hand has been up for quite some time, but I think maybe it's the challenges I'm having with network that's making me to disappear constantly. However, I'm on page 157, Chair, under injury on duty. Can we be provided with details of the cases and whether any of these cases included COVID-19? On the same page, Chair, under utilization of consultants, can the committee be furnished with details of company ownership for each of these private consultants or contractors, and what processes was followed to select these consultants? My last question, Chair, will be on page 158 under utilization of consultants again. Kindly provide me with more details regarding to the legal services that was rendered. For now, I am covered, Chair. Thank you very much.
Thank you very much, Member Barnes. Can I kindly ask members to lower their hands? I will now give over to Dr. Mbombo as well as Dr. Klute. Thank you.
Thank you, Chair. Again, it's general because the department will be able to respond. I think the first one was on the Barry survey in terms of the culture, which is we do it almost annually. I think that one was 2019. We will have results for the others that will be done, but due to COVID, probably the department can explain if we still continued with it, but noting there are many other ways of evaluating the satisfaction in addition to the Barry surveys, because we can do it also at a local level, especially I'm speaking now specifically now post during the COVID, so there might be some changes. I can explain to that, but again, what Member Basson indicated that throughout year by year, we have seen some changes of where the results are good in regard to previously years ago, when we find that there were some of the concerns in relation to the culture and also in terms of the interrelation. So these have changed. Then in regard to the employment equity, the department can respond. I think when we submit or present the current, the 2020 report, you'll see that things will have changed. But again, if I could make an example, the culture of every kind of a setting, it will always have an influence, setting or even sector. Just making an example, where you might get like in housing, Department of Housing, where you might find that it's a sector that may attract more of, I'm talking about at the senior level, I'm not talking about at the lower levels. It may attract more of the people who are maybe African males, just making an example. Whereas, for example, in some of the sectors where you find that in our sector, when I made an example that some people might say, why would I, like I'm a medical specialist, so why should I want to be bogged down to be an administrator in the Department of Health, where probably I could just have my own practice? So one have to look in regard to that kind of in regard to that space, but we find that things have changed completely. As for now, I think the sexual harassment, we did respond, but the department can respond again. In as much as that, if you look at the number of cases that are there, you'll find that actually the stealing and all of those formed more of the cases that were found compared, for example, to the sexual harassment. But we do understand that for us, it's personal. It's about when the other person has been wronged, whereas with the stealing, it's about we are stealing like company equipment and all of those. So I do understand why the members feel strongly. I also feel the same way in regard to want more information in regard to the sexual harassment, because it's about the emotions. It's also about the issue of the gender inequalities. It's also the issue about the power. In as much as that the percentage is not as much. I think the IODs and all of those department can respond to that. Thank you, HOD.
Thank you very much, Minister. Dr. Klute.
Thank you very much, Chairperson. In relation to the first question on Barrett survey, I refer the member to page 39. If you go to page 39, you see the result of the 2005 Barrett survey, the 2015 Barrett survey, 2017 Barrett survey, and then the 2019 Barrett survey. You can see that a level that we look at, which is a level to explain your culture, something called cultural entropy. Entropy means whether there's discord between the individual and the workplace, how they experience the workplace. You see that level has dropped from 21% to 18% to 15%. That is, it's exceedingly positive results for an organization of our size. We also take that Barrett survey and we snippet it down to individual units within the department, discuss it, and you can then see another factor there, which is what we call potential limiting values. It dropped from 4 potential limiting values to 1 value to 0 in 2019. And then what is called the value match. And a value match is, do I believe that the workplace that I work in matches my own values and would make me want to stay? You see that was 5 in 2015. It went up to 7 in 2017. It stayed at 7 in 2021. A value match of 7 is extremely high. And it explains, remember, why people are saying they want to be retained in the organization. As the minister said, as we come out of COVID, we and the education department has made a strong motivation that we want to continue with the Barrett survey as an external marker of our culture. Staff satisfaction, similarly, you saw the results on page 124. And at the paragraph immediately underneath the 2 tables, it explains why we're doing this. We believe that staff satisfaction together with Barrett's is the reason why we want to create a work environment for people to be retained. We look forward to doing staff satisfaction beyond COVID. My understanding, Chairperson, is that on the question of the employment equity 141 for Member Windvogel, the Minister has started asking that. We want to state unemphatically, we promote employment equity in our department. We do everything in our power to make sure that when we apply and when we advertise, we attract people of color, especially people of African descent, into the most senior positions in our department. So we do everything in our power to attract. We similarly do everything in our power to develop internal capacity in our department for people to be promoted. And definitely our plan is over the years to significantly change the face and the feel and the representativity in our senior management team. And in future reports, we need to report on progress made in that regard. I understood from you that the misconduct will be a resolution and we will then submit the details. I don't have to respond. And I also understood from you when it comes to injury on duty, just to answer Member Bonds, these injury on duty that says the number of the injury that required basic medical attention only, that the temporary disablement and permanent disablement, none of these are related to COVID The reporting period is until the 31st of March 2020. We only had our first case on the 9th of March, so none of this reports relates to COVID. But if details is required, we can provide the details of that if so wish. And then the last one, utilization of consultants. I understood that Member Barnes were asking for the details. There's a long list from page 157 all the way through to 158. And then she wanted specific detail on the legal services that I'm still trying to find on this list. So I'm not quite sure which element of this list. It's the last one, the law state advice service. Yeah, I can understand. I can explain that very clearly to you. This is our medical legal unit. Minister Mbombo referred that earlier, that we actually we have a best practice unit in the country. The National Department is learning from us. They're trying to use our system to try and do the same in other provinces. As I indicated earlier, Dr. Waddington is now representing that unit on this call as well. But we are very proud of what that unit achieves. And what that unit does, it fights all the cases against medical legal claims put in at our department, and we get legal representation to make sure that the payouts that we do as a department is not excessive. And we've structured the agreement. We counter frivolous legal challenges, and we do proper detailed work to defend cases, to not have to pay the scarce money that we have for unwarranted payouts in terms of medical legal claims. Thank you very much, Chairperson.
Thank you very much, Dr. Klute. Members, are you happy with the answers provided? I see no further hands. Members, Part E of the report is also dealt with by SCOPA, pages 159 to 163. At this point, I will now request this annual report meeting is also a public hearing. So if there is any member of the public on the platform, I will now afford you an opportunity to either give input on this report or to pose a question to either Minister Mbombo or Dr. Klute. Are there any members of the public that would wish to raise a question now? I do not see any indication from my side. Perhaps from your side, Ms. Jamke?
No, Chairperson.
Thank you very much for that confirmation as well. Members, at this point, I think Minister Mbombo as well as Dr. Klute and the departmental official has been very thorough in their response, with us reflecting on the 2019-2020 annual health report. I then now wish to thank Minister Mbombo. I wish to thank HOD Dr. Klute, as well as all departmental officials for attending this meeting this morning. And thank you so much for duly responding to the questions that was posed to you, and that we were afforded the opportunity to reflect on the 2019-2020 year annual report. I also wish to thank all stakeholders. There is no members of the public present today, but thank you so much, Minister, Dr. Klute, and all our departmental officials, and also thank you to all members for scrutinizing this report and posing your questions this morning. So we will now excuse you, Minister Mbombo, Dr. Klute, as well as the department. I would then gladly ask that members please stay online, and thank you again for your time this morning, and wishing you all the best with the rest of your day, and please be safe out there. Members, please stay on the line. Thank you very much. Members, we are well within our time, and we were supposed to take a leg stretch at some point. Before we deal with our recommendations and our resolutions, would members wish to take a 10-minute comfort break, or can we proceed?
Chairperson,
Bosman?
unless you really need to go to the bathroom, I'm happy for us to proceed. But I'm mindful that you have been chairing for more than 2 hours now.
I am quite happy to proceed. Thank you for that consideration, Member Bosman. Any other member that has a different view? Member Windvogel?
I support Member Bosman's proposal, Chair. Thank you.
Thank you so much. So we will then duly proceed. Members from your side, are there any? There are. Let me ask Ms. Jamke what she has recorded in the duration of the meeting, and then we can just consider and add on. Ms. Jamke?
Not much, Chairperson, but a few. The first one is a detailed report on the renovations made in 2019-2020 financial year and which hospitals are on the waiting list for renovations in the province. The other one, I am not sure if Member Van Wochel still wants, whether she wants the copy of the preferential procurement policy or what's there. I did not get that one right, but I know that it was an issue surrounding the preferential procurement policy. And let me check quickly. And the other one, I think, is the information that was requested by Member Barnes, which is detailed information on the fraud cases during the, I think, the financial year under review, which is now 2019-20, and how much was stolen, what were the sanctions that were handed to those that were found guilty, and which is the detailed information on the injury on duty. And she asked whether there were COVID-related cases, and the department has answered that and said that there were no COVID-related cases during the year under review. And the utilization or detailed information on the companies, I think that one is on page 157, but I don't know how to structure this one. The companies. Yes.
Yeah, thank you very much, Ms. Jamke. Members can kindly just clarify their recommendations or their resolutions. I'll just go down the line. Member Bosman, is there anything that you would wish to add based on what was recorded?
No, Chairperson, but I just wanted to ask if we could be a little bit more specific on the resolution about more information about cases of fraud that was requested. I think that resolution is fairly clumsy at this point. If we could perhaps add the page number and the reference, because this is an old annual report from more than a year ago. So if we could perhaps just make sure that we give that page number. I'm not sure when the member Van Vogel mentioned the page number earlier. I couldn't quite hear her clearly.
Thank you, Member Bosman. Member Barnes. Member Barnes.
Chair.
Yes, please proceed.
Chair, maybe I would like to raise something here that is a bit of a concern. Member Bosman, earlier while we were in the meeting, he interjected and wanted clarity. Chair, that's not right. At the end of the day, we are preparing for these questions. A wrong or a right is cited with you as a chairperson. And then for the department to respond, not for our own committee members to be questioning. It might be looking nice for him today. Tomorrow, it's going to be Member Van Vogel or myself undermining you in a meeting. So in a way, Chairperson, we can't allow, because at the end of the day, we are one committee. We must be representing and also respecting your table. It's your duty to be asking us questions of clarity or who is doing what. Member Bosman is following up on our questions. We are prepared. We know even the one that he's raising now about earlier, somebody asked it, oh, no, on the cases. That page number was flighted. If he didn't hear, it's okay. Nomonde was supposed to hear, but it's not his because he's not chairing this committee. So that one we must correct. Otherwise, it's going to be havoc because today it's convenient for him. Tomorrow, it's not going to be nice. We are going to do the same thing he's doing. I just wanted to raise that, Chair.
Thank you very much, Member Barnes. We can indeed, and that's why I'm affording the opportunity to all members present that where myself or Nomonde perhaps missed out on something pertaining to a resolution, members can add so that we can structure it correctly and properly in order to get the relevant information that we need from the department. So yes, members, I believe as a committee, we've always been very disciplined in our dealings in this committee and our approach. So can we kindly respect each other's roles on this committee and please conduct our business with due diligence and the professionalism that we have always done. Thank you, members. Member Van Vogel.
Thank you, Chairperson. Chairperson, I want to echo Member Barnes on the fact that please, our members must refrain from answering on behalf of the department. That's my only concern, Chair. Chair, then on the clarity on my resolution, it was page 154, and I mentioned the page when I posed that question. And it's for me also a problem, Chairperson, if it comes to asking questions to the department, that we always try when it becomes technical, try to make a resolution. Because for me, the department must know how many fraud cases they have. They must know the details when they come to us. Now they will send us in writing, I don't know when, but when they appear in front of us, they must know, they must have those details. We might want to know how much was stolen and how much sanction were given. They're supposed to know that by on their hands. So that becomes a problem. Perhaps what we need to do is the department must tell us we don't have the facts in front of us, but we will, via writing or whatever, come back to the standing committee. It's just a bit of a concern because now I'm saying, no, perhaps we must make it a resolution, but it's not, for me, it's not right. The department is supposed to know those things. Thank you, Chairperson.
Thank you very much, Member Van Vogel. I note your concern. The annual report itself is quite a thick document, and I don't think that the department can anticipate which questions members is going to pose to them in order to have all that information readily available to us at the committee meeting. So that is why it affords us the opportunity that the information they do not have, and we do take our oversight role most seriously, that we do get the information from them afterwards. So it's not a matter of sparing the department in any way, but we also need to be aware or cognizant of the fact that they might not have all the detail ready available at the meeting. So thank you for that, Member Van Vogel. Member Allen.
Thank you, Chairperson. I'm covered by you. Thank you so much. Bye.
Thank you very much. I see Member Bosman's hand.
Thank you, Chairperson. Chairperson, let me maybe start off by apologizing to Member Barnes and to Member Van Vogel. I was under the impression that we are all members of Parliament and that we work in the spirit of collegiality and we learn from each other. I've always learned a lot from Member Van Vogel, and I've seen her as an expert on health. So that is why I ask questions of clarity. I didn't know that we come to these committees just to listen to questions and to get answers. I thought we're also here to expand our own knowledge. So when I do ask for a question of clarity, Chairperson, it's because I'm really interested in what is being asked, and I want to see what the impact of that question is on my constituents, as well as the committee that I chair. So it is not to undermine colleagues. I always thought that we work very well together, and I'm very disappointed that some of my colleagues feel that that we don't learn from each other, because I've always thought that was the spirit in which we operate. But I take Member Van Voorga and Member Barnes' point, and I will refrain from engaging with them in future. Thank you, Chairperson.
Thank you very much, Member Bosman, for your reply. But I do think that the spirit, perhaps let's take it in a positive spirit. And as mentioned, there has always been a very good working relationship, and all members have the responsibility to actively participate and to perform their oversight at any committee meeting. So you are most welcome to take it offline over a cup of coffee. But yes, let's engage in the spirit of exercising our oversight. Members, I'm not going to entertain this matter any longer. The only question that I'm posing to members now, the resolutions or recommendations read out by Ms. Jamke, are you happy with the input that you've provided, that it captures the information that you would want back from the department? Are you happy with that? Member Van Voorgel?
Chairperson? Yes.
Please proceed, member.
Thank you, Chair. No, Chair, I'm happy. And I want Member Bosman, it's nothing personal. You is also chairperson. En ons leer baie by jou, so it's nothing personal. So ek wil echo wat die chairperson sê, kom ons hou die goeie werksverhouding. En ek dink ons werk goed saam en ons leer van mekaar. Elke dag, ons is nooit te groot of te oud om te leer. So ek leer elke dag van u self. Ja, so kom ons hou daai eenheid tussen ons, maar ek het net die probleem wanneer members begin 'n antwoord op namens die departement, maar om clarity te kry, dis nie my issue nie. So ja, ek wil graag hê ons moet daai verhouding daar hou. So is niks persoonlik nie. Dankie Chair vir die opportunity.
Baie dankie, Member Van Voorgel. I don't see any further hands, colleagues. So provided your input, perhaps Ms. Jamke, I will just ask before we formally, but you will do that in any case, before we formally put those resolutions to the department, that we just have a look at it, just to finally confirm that that is the information that we request back. So the date of our next meeting, members, where we will consider the adoption of this report, will be the 23rd of June 2021, God willing. Are there any committee documents that we still need to deal with at this meeting, Ms. Jamke?
No, Chairperson, on the agenda today is only the annual report.
Thank you so much. And on this part then, I would wish to thank you very much, Ms. Jamke, for all of your support. Thank you to all our WCPP support staff, and thank you to all members that valuably contributed to today's engagement, and thank you for the spirit in which we could have conducted this meeting. I wish you well, members, for the rest of the day, for the rest of the week. Please be safe, and don't forget to encourage our residents to please register to vaccinate, and please be safe out there to everyone. Have a wonderful and a blessed day. This meeting is now adjourned. Thank you very much.
Thank you.
Thank you, Chair.